Hello, my name is Mike Willett with the National Native Network, a program of the Intertribal Council of Michigan. Welcome to the NNN webinar series on cancer risk reduction in Indian Country. This webinar is titled Cancer Survivorship Care. This technical assistance webinar is being hosted by the National Native Network, which offers technical assistance and resources for commercial tobacco and cancer prevention and control throughout Indian Country and the Indian Health Service Clinical Support Center. Your presenter today is Beth Sieloff, MPH RYT 200, Health Educator, Cancer Prevention and Control Specialist with the Intertribal Council of Michigan. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses and physicians. And to obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey. Evaluation surveys will be emailed out within 24 hours after the conclusion of today's presentation. At the conclusion of this activity, the healthcare team will be able to examine the American Cancer Society's Cancer Survivorship Care Guidelines, identify the unique aspects of cancer survivorship care coordination for American Indian cancer survivors, and enlist National Cancer Survivorship Resource Center tools and materials adapted for American Indians to provide American Indian cancer survivors and their families with culturally specific cancer survivorship care coordination. If you have any questions, please type your questions into the question box, the Q&A box on your Zoom panel. Questions will be answered during the last few minutes of the webinar. And now at this time, I will present to you Beth Sieloff.
Thank you, Mike. Welcome, everyone. I would like to give a special thanks to the GW Cancer Center, the Centers for Disease Control, and the American Cancer Society for their contribution and sustained support for this program. This is just an additional acknowledgement. I have no disclosures to reveal. And I'd love to start with the introductions. My name is Beth Sieloff. I am a resident of the state of Michigan. The photo you see here is my mother and her three sisters. They grew up in a coal mining town in West Virginia and all relocated to Michigan when their parents died at a very young age. My mother is the sole survivor of this group you see here in the pictures. My aunties all died of cancer, and my mother, as a result, was a caregiver for them and also for my father. So that is my role, my passion, and why I'm here today. I'd love if you'd share in the chat your preferred name, your role with the Tribal Health Center, and what cancer survivorship means to you. Maybe you're a provider, a survivor, a caregiver, maybe you're all three. It would just be really great for everyone to share and let us know why you're here today. Historically, a person entered the survivorship phase of the cancer continuum once they were 5 years post-diagnosis. However, based on the efforts of organizations like the National Coalition for Cancer Survivorship and Livestrong, the definition has evolved to define survivorship as starting from the time of diagnosis. This definition acknowledges that cancer patients begin their journey from the time they are diagnosed. And that definition has since been expanded to include family members and caregivers. Thank you all for sharing your names and why you're here. It's really important that we as a community support our survivors. Now, while we talk about cancer survivorship, it's important to understand and recognize that all survivors like the term survivor. For some, cancer is not a defining part of their lives, and for others, they do not think the term adequately captures their experience. And each person's survivorship experience is different, and that is what we hope to acknowledge here today among us all. And most recently, you may read that cancer survivorship care is increasingly being referred to as post-treatment care. So we can look at a few statistics here. This chart talks about cancer incident and survivorship for both males and females. The American Cancer Society estimates that in January 2014, 14.5 million people with a history of cancer diagnosis were alive in the US. And that number is growing since 2014. It is expected that 19 million will be alive and survivors in 2014. And most recently, in February of 2022, that number was updated, and it represents about 5% of the population, and the number of cancer survivorships is projected to increase by more than 30% to 22 million by 2030. As you can see in this chart here, over 40% of our male cancer survivors were diagnosed and treated for prostate cancer. And among females, similarly, over 40% of the female cancer survivors were diagnosed and treated for breast cancer. We're going to look at some leading invasive cancer sites. So this slide specifically pertains to Michigan, but we do have slides for areas of the Great Plains and Southwest. So if you're interested, we can always share that information with you. As you can see here, lung cancer surpasses prostate cancer as the leading cause of cancer for American Indians. Colon cancer rates are higher than among the white residents in Michigan. So as you can see, lung cancer, which can often be attributed to commercial tobacco use and exposure. However, when we look at the age groups of our male cancer survivors, which we'll talk about in a few slides, the prostate cancer does exceed colorectal cancer rates. When we look at in leading invasive cancer sites for women in Michigan, lung and colorectal cancer are higher than among the white women counterparts, and lung cancer among American Indian women is almost double the rate of white women. So as you can see, as the prevalence of smoking is higher in a population, inherently the lung cancer rates and sites go up. And then we get to our cancer death rates. As you can see, lung cancer surpasses colorectal cancer as the leading cause of cancer death for American Indians. So we've looked at some of the data. Let's talk about American Indian survivorship. Across all cancer types, Native people have the worst 5-year survival rates of any US racial or ethnic group. Now, this reference is from 2014, but data as recent as February 2022, this reference remains. As American Indians, Alaska Natives are less likely to receive optimal treatment, and they have a lower rate of post-treatment surveillance. And this is often due to the misconceptions of the impact of cancer therapy on daily life that may play a large role in American Indian patients' reluctance to agree to standard therapies. So our therapies are improving, but it's in their mind what they saw, 10, 5, 10, 20, 30 years ago. And so that's why it's really important that we support our survivors in a primary care setting so that they understand that they don't have to be incapacitated during treatment. When we look at age-adjusted cancer rates across the United States, you can see that American Indians and Alaska Natives were the only populations to have death rates increase from 1990 to 2015. And then when we look at survivorship by time since diagnosis, in addition to the types of survivors by gender and site, it's important to understand survivorship by time of diagnosis. About 2/3 of all cancer survivors were diagnosed 5 or more years ago. 15% were diagnosed 20 or more years ago, and almost half of all survivors are 70 years of age or older, while only 5% are younger than 40 years. This shift is quickly changing with the uptake of young breast cancer diagnoses and increased colorectal cancer diagnosis among adults under 50 years of age. Let's talk a little bit about the impacts of cancer treatment. As you know, each individual has different effects and risks. There's surgical side effects, chemotherapy side effects, radiation, hormonal therapy, and non-treatment specific side effects. Regardless of the modality, long-term effects, the effect of treatment during treatment, and late effects that often reveal themselves post-treatment, there are radical impacts of cancer, which can be the result of surgery, like I said, the chemotherapy, the radiation, and the hormonal treatment. Please use this opportunity to identify in the comments some of the impacts of cancer that you have seen or personally endured as a survivor. As a provider or staff in a clinic setting, what impacts have you seen among your patients that you serve in your community? As you ponder that and share that with our participants, let's look at the needs of the cancer survivors. The impacts of cancer treatment can affect the quality of life across 4 major domains: physical well-being, psychological well-being, social well-being, and spiritual well-being. These domains are all interrelated. For example, a survivor who fears reoccurrence may be less likely to seek treatment for physical issues, which may impact their social and spiritual well-being. So when we talk, I love these examples coming up in the chat where Amber put radiation burns. So like that, people would think that's a physical well-being, but it can also affect social well-being. It can impact affection, sexual dysfunction, appearance. And how does that impact your psychological well-being, right? There's depression, anxiety, loss of control, and then that uncertainty and loss of hope, and that loss of inner strength. So that's why it's important that we look at the needs of a cancer survivor as a whole for quality of life. We're going to share to you today one of our partners, the California Rural Indian Health Board, did a lovely interview with Julie White. Mike is going to cue that video up for us, and you may have to adjust your volume.
My name is Julie White, and I am from the Hoopa Valley Tribal Reservation, and I have stage 4 breast cancer. In the very beginning, when I was first diagnosed, I was scared, and I just my initial thought was, I'm dying and I don't know when I'm going to die. I don't see it that way anymore. Um, again, because I've been given choices and options about the treatment I receive. I've accepted the fact that I have cancer, and it's just a part of who I am now, and I don't let it get in the way of doing the things I want to do. I think one of the things that is important is that the clinics are often kind of far away, and maybe it's separate from the oncology that they're receiving, is that those two doctors communicate to each other. Because often one thing really is something to do with your cancer. And if they're not communicating to each other, there's a huge gap that this person is getting missed out on. So I would say, if there's a way that those clinic doctors can communicate with the oncologists or the outside medical doctors. Initially I went along with what the doctors wanted to do. I didn't know anything, so I did what they wanted. And when I was done with the initial chemo treatments and I was put on a preventative chemo, and it didn't keep the cancer from coming back, is when I kind of learned to stand up for myself a little bit and say, we need to try something else. We need to do other things. It didn't change doctors, but I think my doctor listened to me. When I said, you walk into a medical office and the clients there are twice your age and older. I don't fit into the same mold they do, and I think they need to take a look at that, really provide treatment that's based on the person coming in and not what they normally do. I think, for me, I relied on my family, and I'm meeting some other people with that. They don't have that support. So it definitely is important to find somebody that you can lean on or talk to, or just, have come sit with you and watch TV, because sometimes that's all I wanted, was just somebody to be there. And you have to learn to speak up for yourself to your doctors and say, this is too much, this is too hard, what can we do? Because I know for me, my doctor listened to me, and we've adjusted things so that I can still go through chemo, but I still get to live my life the way I want to. One of the things that I did get to do is that I have family who are medicine women. And that was one of the things they said they wanted to do, was to have a healing ceremony for me. That healing ceremony that they did for me was probably the most powerful and most healing thing that I have ever experienced or had done. It was 2 of my cousins and my aunt who prayed over me, and and I was laying down, and they started praying, and when they were praying, I just kind of started crying, because there's so much emotion that you feel. But one of the experiences was that the room got crowded with people, and there wasn't people that you could see, but I could feel the people come into this room. I could hear them talking and laughing, and I knew they were my ancestors. They made me feel at ease being in there. And I had one of my aunts holding my hand. And during that time, my grandmother came in, who passed away when I was 17. And I could distinctly feel her touch on my hand. And when we all went home and we were talking about it, everybody said they felt somebody touch their shoulder. And my daughter said, I thought it was my cousin putting her arms around me. And when I looked, there was no hand there, but she felt that hand, and when we talked to everybody felt that hand on their shoulders. And I knew it was my grandma because she was sitting there holding my hand the whole time. Even though I know it was my aunt, I could feel my aunt's touch, but there was a totally different touch that was on my hand, and it was my grandma. I see all this in my mind, yet my eyes were closed during this whole ceremony, but it's not that I could see them as much as I could feel them and their presence. And it was just like, and so when my family, I could hear them stop praying, is when they started to leave the room, and I didn't want them to leave because it was just so comforting to have that there. When my family was done praying and the people left the room, there was so much weight lifted off of me. I felt like a different person. And so if people have access to the native healings, the native praying, try to do that, because it's so powerful, more than I think anybody really knows until they experience it.
I just, every time I see that video of Julie, it's very impactful. And I noticed in the chat, Tammy mentioned something about social and emotional support. And I think, Julie really emphasized that. And you as providers, regardless of your location, right? And regardless of your role in the clinic, you could be receptionist, you could work in the lab, right? Just make these connections with our survivors, because the cultural needs of American Indians are often not met because they have to step outside their culture and norms for treatment. They have to travel great distances often, right? If they're from rural areas, they often have to travel up to 6 to 8 hours for treatment. And these culturally focused education programs in the community to inform patients about cancer therapies could increase their acceptance and treatment. And I want to highlight here, let me get the slide, some culturally specific navigation that is available for American Indians and Alaska Natives through the Mayo Clinic Cancer Center Patient Navigation Center. So these navigators are available in Florida, Arizona, and at the Rochester Mayo Clinic. So these cancer navigators are there for that social emotional support, financial assistance and options, insurance navigation, right? Local outreach to local community resources and cultural resources. They support lodging options. And of course, they are always available for transportation options. If you are interested in receiving this flyer, I will send it out to all recipients, or all participants at the end. We have a great relationship with these folks, and the learning goes both ways. And so I encourage you, if you do refer patients to Mayo for support, that you reach out to the navigators and let them know that your folks are making that journey to them. Let's talk about the long-term and late effects. So when we talk about long-term and late effects of cancer treatment, the long-term effects are medical problems that develop during active treatment and persist after the completion of treatment. And then your late effects, right, are medical problems that develop or become apparent months or years after treatment is completed, right? And these effects, right, they can be physical, psychosocial, emotional. So it's really important that we remain aware and ensure that there's follow-up and care available for our patients during treatment and throughout their lifetime. This next picture here, we talk about potential physical impacts. And I think I really want to highlight here that it's not just the physical impact of the survivor making that journey, right? There are physical impacts on family members. And as you can see here, we have a picture of what could be a multi-generational household, right? And so we assume that this gentleman, right, is undergoing cancer treatment and getting follow-up care from a home nurse. But what type of impact is this having on his wife or his grandson, right? I can tell from personal experience that when my mother was caring for my father, she was so worried about infections and her anxiety levels got so high that her nails started to fall off and no doctor noticed, right? And so these types of things, right, the potential physical impacts are not just with the individual undergoing cancer treatment, but the potential physical impacts go all into all members of the family and the caregiver core. Here, we're just going to take a quick look at the potential long-term and late effects by treatment type. And the impact depend on so many factors, right? Including the type of diagnosis, the treatments being provided, and the age of the patient. This list is not exhausted, and some survivors may experience few of these, and some survivors may experience many of these. Western medicine is getting better at predicting who will experience which effects and when. Nonetheless, these effects need to be managed. So when they do occur, you can ensure your patients have access to their oncologist, that the primary care provider is aware, that there's traditional healing support, and there's a pharmacist there to manage both the long-term and late effects of cancer treatment. And then we'll look at the potential psychosocial impacts of cancer and its treatment. And this list can go on and on, right? So general psychosocial long-term and late effects can include depression, right? Distress, worry, challenges with body image, challenges with self-image. There's a whole list here for us to go through. But most importantly, this list demonstrates some general psychosocial long-term and late effects and what you as a provider, as a member of a clinic staff, a caregiver, or a community member can be aware of and insightful of when you are caring for cancer survivors. And then once again, right, we talk about the cultural aspects of long-term and late effects in American Indian patients. It's not cultural norm, right, to discuss many of the long-term and late effects of cancer treatment, right? And that's why it's really important that primary care providers make gentle inquiry to patients on their well-being and develop survivors' social networks within tribal communities. So we talked about the long-term and late effects of cancer survivorship and cancer treatments. Let's talk about prevention and wellness. Tribal health systems, as you know, are inherently designed and equipped with high quality prevention and wellness programs. As in the general population, prevention and wellness are important for cancer survivors. However, they may not be having the same prevention and wellness discussions with their healthcare team. So often healthcare teams, right, they refer the patient, right, to an oncologist, which is usually outside their tribal health system. And then everyone is so involved with cancer care and cancer treatment, they start to overlook other prevention and wellness programs. So this is just a reminder that we want to maintain our regular wellness visits for our patients as they undergo cancer treatment, and that you're ensuring to follow up with those admission, discharge, and transfer notices so that you can be abreast of where your patients are on their journey. So how do we empower survivors to live well? Right? We talk about prevention of other cancers, and the comorbidities that can influence cancer risk, right? Hypertension, type 2 diabetes, and cardiovascular disease, which are all prevalent disparities in our American Indian, Alaska Native communities. And then ensure general wellness, right? Diet, exercise, and psychosocial well-being, and surveillance and screening for wellness and other cancer sites. And when we talk about, I want to just go back up to general wellness. Cancer survivors are at risk for recurrence and develop secondary cancer. So lifestyle recommendations for chronic disease prevention are critically important. And you may have noticed it was distributed, I think, on March 16th, right? The ACS, American Cancer Society Nutrition and Physical Activity Guidelines for cancer survivors were updated. And again, right, unfortunately, they highlight that Black and American Indian populations continue to experience greater poverty and racism, both systemic and structural, and often lack access to culturally competent care in accordance with the guidelines for nutrition and physical activity, including availability, accessibility, and affordability of healthcare services, which result in lower survival. So once again, while we're ensuring, right, that everyone is safe on their journey during treatment, we want to make sure that we address general wellness and prevention as they're on that journey. And as we talk about this subject, I want to applaud our tribal health systems, right? Our tribal health systems are inherently an integrative health system that includes behavioral health, primary care, often spiritual healers, dentists, optometry, and diabetes educators. So, and like I said, we often get so buried in workloads that we forget the resources within our own health system. And so I just want to remind you, right, that you have this wonderful integrative health system, and it's really important that you take advantage of it, right, to support your cancer survivors, that you, as Julie said, make these referrals to traditional healers. And for those who are commercial tobacco users, right, that you can refer them to tobacco cessation programs and ensure that, you know, use your nutritionist and diabetes educator to ensure wellness and prevention of future cancers, right? And then that spiritual and psychosocial support with the behavioral health and what they can do for folks on that continuum of cancer. And these are just another list of potential programs and services available in our tribal communities. I really want to give a big shout out to our financial assistance programs, as financial assistance is often needed when individuals are traveling outside their community for support and care. So please make sure that purchase referred care, insurance navigators are given the resources they need, right, to support our survivors. And then once again, right, we talk about nutrition and physical activity guidelines for cancer survivors. The American Cancer Society has released nutrition and physical activity guidelines specifically for cancer survivors. And some of those guidelines include that they should achieve and maintain a healthy weight, right? Engage in regular physical activity, and achieve a dietary pattern that is high in vegetables, fruits, and whole grains. And as we talk about this, many of our survivors, right, are dependent on the food distribution program on Indian reservations, the FDIPR program. And we're very lucky that that program has transitioned and has availability of fruits, vegetables, and whole grains for the FDIPR recipients along with SNAP. So when we talk about physical activity, so we've kind of talked about the nutrition side, we talk about the physical activity side. So the recommendation, right, is 150 to 300 minutes a week, right? And some communities don't have that physical infrastructure of a gym or sidewalks. And I would love if you could share in the comments, right, some other ways that your community does or can support physical activity for cancer survivors. And I want to make sure that you don't forget about traditional dancing, right, as a method of aerobic exercise. Thank you, Erin. I love the walks and talks, right? I hope you all are watching the chat because we're getting some great ideas and feedback out there. Just as Julie mentioned in her story, spirituality is something to consider in relation to cancer survivorship as well. Spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to their self, to others, to nature, and to the significant or sacred. Studies have shown that spirituality helps patients with chronic illnesses, end of life, and a better quality of life, increases one's individual will to live, improves coping skills, improves stress management, pain management, and importantly, it enables patients to have more realistic sources of hopes, right? Meaning in life, reconciliation, hope for finishing important goals, and not being so hyper-focused on being cured, right? Spirituality is a patient need, just as Julie really exemplified in her talk. So when we talk about the formulation of assessment and treatment plans, this is not just the role of the oncologist, right? And it's really important that our primary care providers, right, our traditional healers are involved in the formulation and the assessment of the treatment plan. While the oncologist may do the recommendations, right, for radiation, surgery, chemotherapy, it's that primary care provider and that coordination of care that ensures that we're supporting the whole patient, right? Those 4 domains of survivorship. We talked about the long-term and late effects of cancer treatment. Let's touch on rehabilitation. Rehabilitation is recognized in other areas of medicine as being a critical component of care, and it can be helpful in cancer survivorship as well. As you can see here, rehabilitation can significantly improve physical, psychological, and quality of life outcomes in oncology patients. And yet we still have cancer survivors that have unmet needs related to rehabilitation, right? Now think back to a few slides and remember the 2022 nutrition and physical activity guidelines for cancer survivors. So it's really important here, right, that the primary care provider reach back to the oncologist to ensure that EHR records are being updated so that if there are long-term and late effects that are recognized in the primary care setting, that they can be addressed promptly and ensures there's no duplication of effort with the oncologist. Smoking cessation. I want to ask a question, and admit there may be some providers, practitioners here on the call. Do you recall any patients that you have cared for who have had a cancer diagnosis and are still using commercial tobacco, right? And are we as clinicians, practitioners, and providers referring our cancer patients and cancer survivors to smoking cessation resources upon diagnosis of their cancer? I don't really think I need to read all of the benefits of quitting smoking, right? As we all know they're there. But we do want to ensure that there is just that extra awareness, right? That we are utilizing the tobacco cessation specialists within our health systems and our local health systems, or referral to state and national tobacco quit lines. So we've touched on the aspects of survivorship. I'm going to highlight now some of the survivorship guidelines that are available to you, right? And that have different areas of focus. So many of our national organizations, right? The National Comprehensive Cancer Network, the American Society of Clinical Oncology, American Cancer Society, George G.W. Cancer Center. So we have all of these available resources, right, for providers and survivors. And these guidelines are not just based on recommendations of Western medicine. These guidelines are often holistic, cover multiple domains, including surveillance, screening, health promotion, and most importantly, care coordination. So when we look at the American Cancer Society survivorship care guidelines, right, we talked about surveillance for cancer reoccurrence, screenings, right? How many women have not had mammograms after cancer treatment, right? It's just kind of, they have cancer at another site, kind of slips off the calendar. So that's where these patient reminders in our EHR and our primary care providers are that safety net for these screenings. Assessment and manage of physical, psychosocial, long-term and late effects, health promotion, and care coordination. Let's look at a few of, we'll look at one of the guidelines. Mike, do you mind clicking on that colorectal site? See if we can bring that up.
Yep, just a moment here.
Let's see. Nope, that's okay. We will send these guidelines out to you. I don't think it's coming up for us today. Oh, here we go. So as you can see, we'll send these slides out and you'll have links to everything. All right, thanks, Mike.
Is that what you wanted to see there?
Yeah, we're good. We can
Okay.
close that up. The joy of webinars and Zoom, right? Here we go. So when we talk about survivorship care in our rural and often austere areas of the United States, right? It's the primary care provider has a big role in cancer survivorship care. And it's not just the primary care provider, right? It's the folks that the survivors meet when they first walk in the clinic, right? When they're checking in, when they're in the lab, when they're with the MAs and the nurses, right? Doing their appointment screenings. So we want to promote healthy behavior, right? And we want to assist in this surveillance for cancer recurrence, right? And secondary primary cancers. And that's the provider's role, but it's also the role, right, of the MAs, the nurses, and those folks, like when you're in the clinic and you just ask those patients, how are you doing? How are you feeling? and relaying that information to the provider. And then, of course, assessing and managing physical, psychosocial, long-term late effects. And that's where that, that integrative health system comes in, whether it's all in one structure, physical structure in your community, or it's a whole, county, city, and tribal community network. And of course, the clarification of roles when needed with other members of the cancer treatment team. Well, let's see if our slides are going to go. Okay, so we have such a large group here today, and we want to leave time for questions. I first want to highlight the Cancer Survivorship e-learning series for primary care providers. So this is available through GW, and we will send out the link to this. This is a great course. It provides CEUs at no cost, right? They're 1 hour modules, they're self-paced and can be completed in any order. So if you have a focus on something specific for your practice or your patients, you can always do that module first. And anyone who has taken the course has given it a great rating. And we have had some of our providers in Michigan take this course, and it has changed their practice. And just like Julie, Cribb shared today with Julie, each model, just like we saw today, includes a survivor interview, narrated presentations, pre and post assessments, so you can measure your learning for that module, and then an unending list of resources for you to use in your practice. So today, here's some just additional resources, right? We have the National Cancer Survivorship Resource Center, the e-learning series for primary care providers, and the American Cancer Society Prevention, Early Detection, and Survivorship Guidelines. And of course, we'd love to hear from you, right? If you have any questions, you can reach out to the GW Academy. You can reach out to the National Native Network and the Intertribal Council of Michigan. Mike, do we have any questions?
We do have some questions in the question box here. This first person here says that he's working with the Winslow Indian Healthcare Center in Winslow, Arizona, working in partnership with the Navajo Nation. And they wanted to learn more about cancer and use this information to help care for others, including my home tribe of Colorado River Indian tribes in Parker, Arizona. So I think that was more of a comment there.
Well, thank you. And we will send all these resources out, right, to all our participants today. So that, and if you need any additional support, we've had some tribal communities in Michigan, and I know our partners at the American Indian Cancer Foundation have additional resources, a virtual talking circle that I encourage everyone to take advantage of.
This person here says a fair amount of patients do not understand fully the impact of cancer diagnosis. From this, some did not seek timely treatment until the cancer grew and spread. So again, that's a little bit more of a comment. I don't know if you wanted to elaborate on that, Beth.
Well, and that's where, health equity is really important. Understanding the social determinants of health and the health literacy of our patients. And often people are offended by that word literacy, but it's really truly something that we need to understand, right? And take away that, people may be associating what anticipated cancer treatment of what they saw happen in the 70s and the 80s and the early 90s, right? And now we have these amazing care teams. We have these amazing navigation support, right? Like we see at Mayo Clinic and our larger academic health systems, right? And so we want to ensure that the care is there, that there's outreach and support from navigators to avoid, right, that loss to follow-up.
Again, if you have any questions, please type them into the Q&A box, and then we'll be sure to answer those over the next few minutes here. We'll keep, as long as if questions are still being typed into the question box, we'll stay on until the top of the hour. This next person here says a fair amount of patients do not fully understand the impact of such cancer diagnosis from this. Okay, I think
Yep.
that's the same.
And then I
question we
want
just
to
asked.
talk, Chief Michelle Mitchum had
Yep.
something in the chat. And there are
Yep.
specific resources and suggestions for materials for the cancer patient's family. There's caregiver guides. I will make sure that you get those links. I will get your address, email from the registration, and I will make sure that you have access to those resources, because there are a number of resources for families and caregivers, and I can also send you a toolkit. Great, thank you, Chief.
Awesome. And then this person here, Roderick had asked for the Mail Clinic flyer.
Oh,
so
for
if
sure,
maybe you
yeah.
want to drop your email in the chat box or something, then we can make sure to get that to you as well. Then this person here, I think that they may just want a little bit of clarification on the idea of the cultural norm to discuss the effects of cancer. They recommend that it's more of a tribe by tribe or family by family.
Oh, thank you.
So yeah, and then we will be archiving all of the presentation today. If you visit our website, keepitsacred.org, click the resources tab in the left menu of the homepage, and go ahead and click the webinar archive tab. Let your colleagues know that the webinar will be archived there as well. We will have the video of the webinar along with the presentation slides from today on there.
Tracy Nelson, I got your note.
And if you have any other questions, please feel free to type them into the question box. We will make sure to try to get those answered here over the next couple of minutes.
And we will share the PowerPoints with you. So I'll put together an email with some links and the PowerPoint. And I just am very grateful for all of you that shared today and joined us on this talk.
Absolutely. Well, I'm not seeing any more questions coming up here, Beth. I just see a couple of comments. One just came up. Oh, let me see here. This person here says, what is the role of cancer genomics in Indian country? That's in the chat box.
I will, I do have some information on the cancer genomics. We are doing a big push to increase the knowledge on that subject. But as you know, based on historical trauma and interface with the government, often that is not well received, but we're doing our best, right?
This person here says, what can ACS do to advocate for covering transportation costs for patients and survivors, especially for those that have to travel greater than 75 miles?
I do know that some purchase referred care funds are done for that. I do know that some comprehensive cancer grants fundings are available to support structural barriers, right? And financial barriers. And I do know that most major health systems have financial support for individuals undergoing cancer treatment. So it's really important if you, as an insurance navigator, purchase referred care manager, provider, or caregiver, supporting a cancer patient, make sure that you help them reach out and use their voice, right? Use their voice on getting support. Just like Julie said, she found her voice and she had to speak for herself. So sometimes people aren't able to speak for themselves, so that's why we're here.
And it looks like there's another couple of comments coming up in the chat box. One person says that they've noticed COVID had a huge impact on detecting cancer. There's no mobile cancer screening around their area.
Chief, I will also, I'll send you a note about how we do our outreach for mobile screening in our rural areas in northern Michigan, because I know the struggle, so I'll give you any help I can.
And then a couple more comments. Extremely insightful, particularly of the spiritual side of healing. Thanks for the good information. This person here says, is there new cancer research being established for the new tribal migrates coming from Central America?
I have no information on that.
Okay, so yeah, other than that, I'm not seeing too many more questions come into the question box right now. You think that this might be a good spot to break, Beth?
Yeah, I think we're good. And I, again, thank you everyone for sharing your stories, sharing your ideas, and we'll put all of this together so that you can share it with your staff and community too.
Fantastic. Thank you very much. Again, keep in mind that there will be the SurveyMonkey evaluation that will be emailed out within 24 hours at the conclusion of this webinar. So if you plan to obtain CEs for the webinar presentation today, be sure to complete the evaluation in its entirety within the next week. Please visit our website, keepitsacred.org, to find this and other technical assistance webinars, as well as other cancer and commercial tobacco prevention resources for tribes and tribal organizations. The archive of this webinar will be at our website, keepitsacred.org, within the next 24 hours. And make sure to follow us on social media. We're on Facebook, Twitter, LinkedIn, YouTube, Instagram, the whole shebang. So thank you very much, everybody. Have yourselves a wonderful day.
Thank you. You there, Mike?